Finally, for the first time in Medicare's history, the federal government negotiated directly with drug companies and won. 10 of the most expensive prescription drugs that seniors depend on just got cheaper. Some dropped by more than 50%. One dropped by 79%. This affects nearly 9 million Medicare beneficiaries. And if you're on any of these medications, you need to understand exactly what happened and exactly what the catch is. Stay with me. Here's what most retirees don't know. For decades, Medicare was legally banned from negotiating drug prices. Banned. While every other developed country's government sat across the table from pharmaceutical companies and haggled, America's seniors paid whatever the drug companies decided to charge. Blood thinners, diabetes medications, heart failure drugs, cancer therapies, some costing $500 or $600 a month per drug. That changed with the Inflation Reduction Act of 2022. And as of January 1, 2026, the first round of negotiated prices is now in effect. This is historic. This matters for your wallet. And there is a catch that most people haven't been told. Let's go through all of it. Part 1. What actually happened? The big picture. The Centers for Medicare and Medicaid Services, CMS, negotiated directly with drug manufacturers for the first time ever on 10 high-cost brand-name drugs. These are medications that had no generic or biosimilar competitors at the time they were selected, drugs that millions of seniors rely on every single month. According to CMS and the Department of Health and Human Services, the negotiated prices represent discounts ranging from 38 to 79% off the 2023 list prices. The projected savings? $6 billion for the Medicare program in 2026 alone. And for Medicare beneficiaries like you, $1.5 billion in reduced out-of-pocket costs this year. AARP's research confirmed that out-of-pocket costs for these 10 drugs dropped by an average of 51% compared to 2025 across 56 standalone Medicare Part D plans they reviewed. That is not a rounding error. That is real money back in your pocket. Part 2. All 10 drugs is yours on the list. Write these down. Check your medicine cabinet right now. Number 1. Eliquis, used for blood clot prevention and treatment. Old price for a 30-day supply, $521. New negotiated price, $231. That is a 56% reduction. Nearly 4 million Medicare beneficiaries used Eliquis in 2023. Number 2, Xarelto. Also a blood thinner, used for blood clot prevention and for coronary or peripheral artery disease. Old price, $517. New negotiated price, $197, a 62% drop. Number 3, Januvia, a diabetes medication from Merck. Old price, $527. New negotiated price, $113. That is the biggest percentage reduction on the list, 79% off. Roughly 850,000 Medicare beneficiaries used Januvia in 2023. Number 4, Jardiance, used for diabetes, heart failure, and chronic kidney disease. Old price, $573. New negotiated price, $197, a 66% reduction. Number 5, Farxiga, used for diabetes, heart failure, and chronic kidney disease. Old price, $556. New negotiated price, $178, a 68% reduction. Number 6, Entresto, a heart failure medication. Standard of care for heart failure with reduced ejection fraction. Old price, $628. New negotiated price, $295, a 53% reduction. Number 7, Enbrel, used for rheumatoid arthritis, psoriatic arthritis, and plaque psoriasis. Old price, $7,106. New negotiated price, $2,355, a 67% reduction. For anyone on Enbrel, that is potentially thousands of dollars a year. Number 8, Imbruvica, used for certain blood cancers. Old price, $14,934. New negotiated price, $9,319, a 38% reduction, the smallest on the list, but on a drug costing nearly $15,000, that still represents significant savings. Number 9, Stelara, used for psoriasis, psoriatic arthritis, Crohn's disease, and ulcerative colitis. Old price, approximately $14,000. New negotiated price, $4,695, a 66% reduction. Number 10, Novolog and Fiasp, insulin products for diabetes. New negotiated price, $119, a 76% reduction. If your name or a family member's name is associated with any of those 10 drugs, you now have access to significantly lower prices through Medicare Part D. All 10 of these medications must be included on the formularies of every Medicare Part D standalone plan and every Medicare Advantage plan with drug coverage. That is the law. Part 3. How to actually access these lower prices. Here is what you need to do to make sure you are getting the lower price. First, call your Part D plan directly. Ask, is my drug on my current formulary and what tier is it on? The phone number is on the back of your insurance card. Plans are also listed at medicare.gov. Second, log in or call to review your plan's 2026 Summary of Benefits and Evidence of Coverage. This document shows exactly what you pay for each drug at every tier. Third, if you're not sure whether you're in the right plan or whether you're getting the savings you should be, call your local SHIP counselor for free. SHIP stands for State Health Insurance Assistance Program. These are trained, unbiased counselors paid by your state to help you navigate exactly this kind of situation. Find your SHIP at shiphelp.org or call 1-800-MEDICARE. Fourth, if you use one of these 10 drugs and your plan isn't reflecting the lower costs, contact the Medicare Rights Helpline at 1-800-333-4114, Monday through Friday. They can help you understand your plan formulary and navigate your options. This is the part you must hear. Now, the catch. And there are actually 3 of them. Catch number 1. The lower negotiated price is the maximum fair price that Medicare pays to the manufacturer. But your actual out-of-pocket cost still depends on how your specific insurance plan classifies that drug on its formulary tier. A plan could still place one of these drugs on a higher tier, and if it does, you could end up paying more in copays than you'd expect. The negotiated price lowered the ceiling. It did not eliminate your plan's ability to assign cost sharing above what you might anticipate. Catch number 2. Entresto, the heart failure drug, had a generic approved in July 2025, after the negotiated prices were set. As a result, some plans have adjusted how they cover Entresto. If you take Entresto, call your plan directly to confirm your current coverage and costs. Do not assume. Catch number 3. These prices only apply to Medicare Part D and Medicare Advantage plans with drug coverage. If you are still buying these drugs outside of Medicare, through a private insurer or out of pocket, these negotiated prices do not automatically apply to you. You need to be enrolled in Medicare drug coverage to benefit. The bottom line on the catch? The savings are real, and they are significant, but they are not automatic. You have to be in the right plan at the right tier for the right drug. That is why calling your SHIP counselor and reviewing your plan is not optional, it's essential. One more thing worth knowing. This is just the beginning. The next round of 15 additional drugs has already been negotiated. Those prices take effect in January 2027. That list includes some of the most widely used medications in America, including blockbuster diabetes drugs. After that, 15 more drugs in 2028, then 20 more every year after that. The program is expanding, the savings are growing, but you have to be in a plan that covers these drugs, and you have to review that plan every single year during Medicare open enrollment, which runs October 15th through December 7th. 3 things to take away from this video. First, 10 of the most expensive drugs seniors rely on are now available at 38 to 79% off their old list prices, effective now in 2026. If you or your spouse takes any of these drugs, you may be entitled to substantial savings. Second, this does not happen automatically. You must verify your plan covers your drug, confirm the tier it's on, and make sure you're accessing the lower rate. Call your plan, use your SHIP counselor, visit Medicare.gov. Third, this is historic. For the first time, Medicare fought for you at the negotiating table. More drugs are coming every year. Stay enrolled, stay informed, and review your plan every fall during open enrollment. If someone you know takes any of these 10 drugs, please share this video with them today. This information could save them hundreds or thousands of dollars this year. Subscribe so we can keep bringing you Medicare updates that actually matter. Drop a comment below. Which drug on this list do you or a family member take? I read every single one. See you in the next one.